Hey, how's everyone? This is Dr. Darwin, a new dentist coach, and my co-host, Dr. Evelyn Samuel, the efficiency practice guru. We are here. This is another episode of This Week in Dentistry. This Week in Dentistry. We are recording and we are coming live on Facebook Live on my Facebook page, Darwin Kyle Hayes. And this week in Dentistry, what this is about, this is a platform that we've created to bring you news and information about what's going on in the oral health care profession, but also what's going on in the career and the profession of dentistry. So, like I said, this is my co-host, Dr. Evelyn Teague Samuel, and I am right there. That's me. So, hey, this is what we want you guys to do. Every week when we have this show, we want you guys to participate. All right. We want to hear from you guys about some of your comments of some of the topics that we're talking about. We want to hear your comments, and we want you guys to be proactive and just participate. That's what allows us to interact with you and kind of get your feedback as well. You'll be able to leave your comments right here down below as we're discussing it. And one of the goals for this platform that we've created is, again, to keep you informed about the latest news that's going on in oral health, and also for those of you that are dentists or a provider in dentistry or a part of the career and the profession of dentistry, also let you in on some of the news that's going on within the profession. So again, key, please participate, leave your comments below, and we'll be able to actually show them and interact with them as well. All right. So tonight, the big question is this, and this is what we're going to be talking about for a little bit. Will dentistry go to a residency-based type of licensure? Will we have, another question is, will we have some type of national dental exam, some kind of clinical exam that allows all of us to practice wherever we want to practice within the United States, right? And one of the reasons why we're talking about this is that there's a new report that just came out. For those of you that can see me, here it is right here. It's a report put together through a task force. It's called a report of the Task Force on Assessment of Readiness for Practice. Readiness for Practice. And this is a joint task force that put this together. The task force is a combination of the ADEA, which is the American Dental Association, ADEA, which stands for the American Dental Education Association, and then also ASDA, the American Student Dental Association. And those were the main members of the task force that put together this 11-page document that they just released, and it's been something that this task force has been working on for several years. But it just came out this week in September, this month of September. So, Dr. Samuel, I can't remember how many different types of licenses that you have from different states, but did you have to take multiple board exams?
Yes, I have 5 licenses, and had to go through a couple of different licensure exams, and then later on, when I got some of the later licenses, I did the process of credentialing for some of those states, but licensed in 5 states.
Okay. Mm-hmm. Did you have to take different regional board exams?
So I am originally from Alabama. So Alabama has a separate board. And then I took the NERBs, which was the Northeastern Regional Boards.
Right. Yeah, same thing here. I took the Northeast Regional Boards, which cover states like actually New Jersey, New York at the time, maybe Ohio, Delaware,
You see.
Maryland, Washington, D.C., and currently I think I have about 6 different licenses: California, Texas. I had Nevada at one time. New Jersey was my first license. New York, Maryland, D.C., Pennsylvania. Can't forget Pennsylvania. So that's 8.
Wow.
At any given time, I've had at least 5 of them active, currently active, or I think I have 2 or 3 of them now that are just inactive. But I pay every 2 or 3 years. I pay on the for them to be inactive. And one of the reasons why I've done that is because of the fact that, at the time I got many licenses because I didn't know where I was going to end up.
Exactly.
I didn't know where I was going to be. I didn't know if I was going to, I knew I was always going to at some point come back to New Jersey. So that was my first license. But the other states, when I was in the military, I was in pursuit of getting a license for the state of Nevada, which had a totally different type of board. It was their own board, very similar to, I think at one time, Florida was like that. They had their own licensing board, just the same thing with California and Texas, but now they've joined into a regional board. But that's one of the biggest issues right now for a lot of new dentists and even seasoned dentists. If they want to move, they have to take a brand new exam. They have to get patients together for this one single encounter type of an exam, so that they can show that they are competent enough to do this particular couple of procedures that they've been doing in other states with their license for maybe over 5 or 6 or even 10, 15 years. So the way we have licensure right now in the United States is a little outdated, and it's kind of really cumbersome. And there's some ethical issues that are going on with how it's set up right now. And this is one of the things that the task force, one of the reasons why the task force came together to look at some new novel approaches to modern day licensure regulation and kind of make it more standardized. So let me just kind of go over an overview of why this task force is important, and why the contents of this 11-page report is so vital for the future of dentistry. Each year, about 6,000 dental students graduate from dental school, right? And keep in mind, of course, after you go to dental school so you can practice dentistry. So, but in order for you to practice dentistry, you have to get what? Got to get a license, right? And really, the purpose of the license is to show, it's a way of the state showing that there's public safety associated with those that are performing oral health care services. So they want to make sure that the public is safe, and that also that the quality of the dental care that's given to patients is at a particular level. That's why you must get a license. That's why licensure in each state is required. Now, keep in mind, though, there's about a little bit less than 200,000 dentists that are licensed in the U.S. Actually, the actual number is about 196,000 dentists that are licensed in the U.S. And during the period of time of 2011 and 2016, about 100,000 of them moved across state lines, whether it was they moved from Jersey to Pennsylvania, or Alabama to Texas, or California to Washington State. Over a period of about 5 years, 100,000 of that 196,000 dentists, more than 50%, moved across state lines. So in order for dentists to do that, that means they have to get a license in that particular new state line, or that new state that they're in. For some people, it's easier, and for some people, it's a struggle, especially if it's a state that doesn't maybe do what we call licensed by credentials, right? And you've heard about that, right, Doc?
Yes, I've actually done credentialing with a few of the licenses that I have as well.
Right, right. So because again that each of the states wants to make sure and ensure that patients' safety is a premium, that is part of the reasons why we have this licensure process. So this task force took a position regarding dental licensure, and right now the task force is pretty much not in favor of the standard way of how we as dentists are exposed to and have to do licensure, which is we have a patient, we bring to the exam, we may have 4 or 5 procedures total, 3 of them may be patient-based, and it's a one-time, one visit, one encounter, one treatment, and then that's it. So one of the reasons why the task force, and I see and others may have a problem with it, is because doing that one, working on that one patient, on that one tooth or one section of their mouth is not really representative of the total comprehensive care that we as dentists are going to be providing to our patients throughout our course of our careers. So that's a little bit not realistic. That exam with the one patient encounter or one patient visit is not really inclusive of what we're going to be doing as dentists in the practice of dentistry. So you have that. You have the whole notion of what the patient needs in totality just totally neglected because we're just focusing on 1 or 2 teeth or one section of the mouth. So that's one reason why the task force has a problem and they're opposed to it. Another reason is lots of times these patients that we are working on or that are sitting for us for these exams are not our patient of record. They could be a patient that just happens to be in the same state that we're traveling to take the exam, and we do a screening exam on them, and we find out that they need a filling in the upper right-hand side, and it meets the criteria that's placed by the board exam. But after we see them, that's it. They're done. And that's the third reason why the task force doesn't like it. It doesn't, the way that the single encounter exam is set up right now, it does not allow for practitioners or dentists to follow up with the patients after they've received the treatment, right? After they receive the treatment, where's the follow-up? You take your exam, we take our exam, we get graded, we tell the patient thank you, they got a free filling, and in some cases, they might have got paid, they got some money, right? And then that's it, done, we're finished. So that's another reason why they're concerned about how this is set up. And then, like I said, another reason is patients get hip to the situation and how things are done with these board exams, and they start kind of like being like a broker and start trying to play us as dentists, knowing that we need this exam to get our license, and they know that we will do anything for the patient to come in. We come pick them up, we take them out to dinner, we give them coupons, we might give them a free whitening, or they're already free treatment, right, Doc? You've done it, I've done it.
We pay them.
Yeah, and then we pay them, right? We're gonna pay them. So yeah, you be my board patient, and I pay you $100. In addition, you're getting free dentistry.
Right.
So there's some ethical issues with regards to that as well too. So that's another reason why the task force is opposed to it. And then again, the last thing is another reason is because of the fact that you've got seasoned dentists that have to go through this process, many of us, it's been over 20 years since we took this type of single patient encounter type of exam. Not only has it been a long time for us, but at the same time, we've been practicing dentistry in this state of New Jersey, or this state of Virginia, or this state of Alabama. We've demonstrated that we can take care of patients. Why must we go, when we go across state lines, why must we go take this whole exam all over again just because that particular state doesn't belong to a regional testing body, or because that state has its own rules and regulations. So again, you've got seasoned dentists that are taking this exam for the second, third, or maybe even the fourth time, just because the way it's set up is very outdated, and it doesn't reflect the statistics. Like, again, more than 50% of all the practicing dentists, licensed dentists in the U.S. from 2011 to 2016 are traveling across state lines and relocating and moving. So it's an issue. So those are the 6 reasons why the task force is kind of opposed to the way we have it currently set up for licensure. Anything that you wanted to add on that, Dr. Samuels, Dr. Evelyn?
Well, those are all very valid concerns if you just think about what they're calling the portability, or just allowing dentists to move from state to state. If you're having to take all these tests, of course, it's a increased cost to one, and it becomes cumbersome, and just decreases the ability for people to move from state to state, which can, of course, decrease the amount of practitioners that are coming to new states and things of that sort.
Yeah, that's one of the main issues that the task force and others, even us as practicing dentists that maybe want to relocate. Like, for example, what happens? All right, Doc, what happens if and when your spouse is able to gets a new job and he moves to California? Do you have a California license?
I do not have a California license, but that's a very good question, because of course we were in another state and we moved here. So there again, I got more licenses for that reason.
Right.
So you have to do either another test or the credentialing. And even the credentialing is a process. It's so much paperwork that you have to submit. You have to make sure you get notices from each other state that you have licenses in, stating that you're in, your license is in good order. So you're having to do a whole bunch of steps and jump through a lot of hoops just to even credential in different states.
Right. So, and luckily, California is one of those states where you can get licensed by credentials. And there's many other states that have gone to that over the last 10 or 15 years, and what we mean by licensed by credential means if you have, most of the states is 5 years. If you have a license in another state that you've held for 5 or more years in good standing, hasn't been revoked, hasn't been suspended, I think for the most part, if it's in good standing for 5 years, there are some states that will recognize that and say, okay, you qualify to get a license in our state. However, you have to pay the fee, and some of those fees can be anywhere from $1,000 to $5,000. In addition to that application fee, there's all the paperwork that you've got to submit, right? You've got to submit information about your graduation, where you went to school, transcripts with regards to National Dental Board examinations, copies of licenses, in some cases even references. I think you have to have some references, and the list goes on and on. So even though it's a little bit easier because other states are recognizing that you have a license in another state, it's still a process. Like Dr. Evelyn said, it's still a process, but it's not as bad as if you had to take another board exam all over again. And that's what we're talking about, and why this task force report is so critical and so important to know about. So guys, we want to hear from you all. Be sure to participate. Just write your comments down below. We want to hear, what do you guys think? Are you concerned that you may be wanting to move somewhere where you have not taken the board exam before, or a regional board exam? What are you going to do? Are you going to be able to practice dentistry, or are you not going to make that decision to maybe have a dream office or take that dream job or that dream position in Cali or in Nevada or in Texas, just because you're fearful that you've got to take another board, or that you've got to go through that licensing process all over again. What do you guys think? Put your comments down below. So one of the things one of the questions that comes up in this article is whether or not dentistry is going to be going to more of a licensure based. I'm sorry, not licensure based, but more of a residency base, right? Is the U.S. going to make it mandatory that all dental students do a residency, which will then allow them to become licensed in all the states? So that's a question that we're going to answer in a little bit. Another question that we're going to look at is, will there be like a national exam, a national clinical exam in the U.S. that is going to occur, so that everybody, all the new graduates, all 6,000 new graduates that are coming out, are they going to be able to just take one clinical exam and then have all the states recognize it? What do you think, Dr. Evelyn? What do you think about those two?
Well, we'll see if that happens. You know, I was reading that article too, and I noticed that they're even thinking of combining the boards, the national boards, part 1 and 2.
Oh yeah, that's happening. That's definitely happening. That's happening in 2020.
Right, from being part 1 and a part 2 to just one exam. So that's like a major change too.
Oh yeah.
See how they would implement one exam that can be recognized across the states. Would be interesting.
Right. Well, let's go a little bit deeper into this report. Let's talk a little bit about the existing process that's occurring right now in order for you to get a license. So the first thing is, let's see. The first thing is you've got to graduate from accredited U.S. dental school. Mm-hmm. That's CODA approved, the Commission on Dental Accreditation approved, with a DDS or DMD. Those are the 2 degrees that are recognized here in the U.S. So that's the first thing. Everyone has to have that educational requirement. That's the educational requirement that's required. All right. Second part is board exam. We talked about this, right? The National Board of Dental Examiners it's the written exam for all dental students that they must take in order to get a license in the U.S. You must pass part 1, right, which is a lot of the biological sciences. Usually you take that after second year, right, after your D2 year, and you must pass part 2. Part 2 is a little bit less of the sciences, more case-based. What else, Doc? There's some ethics in there, some case-based, maybe some research, a little bit of research, maybe not as much, I don't think, but more case-based, a little bit more in-depth into the clinical side. So you've got to have and show that you've passed it, and you will get a certificate usually from the Joint Commission on Dental Examiners that you've passed this. And you must show this when you are actually applying for your dental license in any state. So that's the written examination part that's required right now, right, for the existing process. And then the last part of the existing process is this one patient single encounter or single visit that we're talking about, that the task force is opposed to for many different reasons. Again, doesn't allow for follow-up care. 2, it doesn't really give the comprehensive, in-depth treatment for the patient. And also, patients are now more savvy. They know that we need them, so they are actually,
extorting.
Extorting. making us pull our own teeth out just to give it to them and making us pay them for that. Yeah, they're extorting us. That's right. They pimping us. Patients as pimps. just because they know that, you know, this is a vital part of our livelihood. You got to pass your board exam so that you can get a license, right? So so that's the current way. That is the current way, or the existing way, that the dental licensure process occurs. Now, let's talk about the good stuff. Let's talk about what they are proposing. And again, this is a task force made up of members of the American Dental Association, also members of the American Dental Education Association, ADEA, and then also members of the student organization, ASDA, American Student Dental Association. So this task force is proposing the following. So here are the similarities and here are the differences. So first, similarity. Yes, still got to have your DDS, your DMD from an accredited dental school. Right now, we've got 68 schools. There's another 10. Is it 10 in Canada? A little bit less than 10 in Canada. So has to be accredited school, number one. Number two, part 1 and part 2 of the national board exam. And like you said, Dr. Evelyn, you're right. This is about to change for 2020. Actually, I think I have some mentees that are in the class of 2022 that just entered for 2018, and some schools are going to use this existing part 2 and part 1 and part 2, but some schools are actually going into the integrated, where it's just one exam for both parts. So that'll be interesting. But again, let's focus on the task force. This is what their proposed approaches. They say, let's keep that written examination, that part. All right. So we got the educational requirement with the DDS, DMD, and we've got the written requirement with the national boards part 1 and part 2. So those two parts of the proposal are the same as it is currently existing. But here's the game changer right here. Here's the game changer right here. What they're also proposing is this, an OSCE. Have you heard of OSCEs before, Dr. Evelyn?
Stop.
OSCE stands for Objective Structured Clinical Examination.
Okay, I did see that in the article.
Yes. So kind of think of it like this. Remember our first year dental school gross anatomy lab, and we had the dissections and we had to participate, but then for most of the exams, we had to actually go to all the different bodies all throughout the room, and we had to answer specific questions about that particular structure. Remember that?
I did.
Well, that's what this OSCE is very similar to, where you have these different case scenarios, right, throughout the room or in the book. I forget how this actually goes as far as how you take the exam, but you have these different case scenarios that you have to answer. That's going to kind of cover, or hopefully represent more of a holistic view of your understanding of how to treat the patient, things to look out for, and such. So what the task force is saying, all right, let's keep part 1, which is the education requirement. Let's keep the second part, which is the national boards, the written exam. But now let's switch it to this OSCE so that everybody takes the same standardized exam. It's not a single patient encounter, which can vary based on the patient, based on the location. Let's just eliminate all that variability out, and let's do an OSCE. So that's one part of the thing that they're proposing, one particular option. The second option really goes back to one of the questions that we asked at the beginning of today, which was doing a residency. Will dentistry go to a residency-based licensure? Now, where I'm at in New York, we were the first state to say yes. You must do a residency to get a license in the state of New York. And we have a lot of people that come to New York just for that, just to get their license because they want to practice in New York. Since then, states like California, Ohio, Delaware have also made it optional, not mandatory, but it's optional that is a way to get a license in those particular states, which is great. But it's only, well, no, it's great for those that do a residency, and it's great for those on the flip side, maybe who haven't done a residency but have at least 5 years, like we talked about, licensed by credential. That's another way people get into the States. Now, the only disadvantage is if you don't do a residency after dental school and you want to move to one of those 5 states, and I think more states are leaning towards it, but if you don't do a residency and you want to go to those states, you have to take the standardized single patient encounter regional exam, which costs thousands and thousands of dollars. You know, you're in Northern Virginia and you want to move to Cali. If they didn't have licensed by credentials or licensed by residency, you would have to take that Western Regional Board or stay on the East Coast while your family goes to Cali. And we know that's not happening.
Option, right?
We know that's not happening.
No, it's not. And there again, you're finding patients and you're in a foreign land.
Yeah, you got to be familiar with the location.
Exactly.
Too much. It's too much. It's just too much. So this is the other proposed option that the task force has that they're recommending. Let's do licensure based on residency. Because if you think about it, that 1 year residency, and again, all residency programs they would have to be accredited programs, number one, and it has to be a year long, right? So what you get with that is you get residents, you get dentists that are now practicing the scope of dentistry that they will be practicing as licensed dentists, right? Comprehensive care. They're able to follow up. They don't have to worry about patients pimping us for the board exam. And it's more ethical and it's more in tune with, again, making sure that the patient is safe and that we are using modern dentistry with modern materials and staying up to date with those treatment approaches. So that's the proposal from the task force.
And what they are thinking too, Dr. Darwin, is once you've gone through dental school, you should be proficient. The schools are accredited, and so therefore you should be able to handle the standard of care for your patients. Correct.
I mean, and that's why they have that. That's part of the educational requirement.
Right.
But you and I both know, we talked about it, I think, last week. You and I both know the experience you get in dental school is not enough to make you so confident and completely 100% competent, at least feeling that you're competent in being able to handle the whole mirage and myriad of patient scenarios, right?
No, this is true, but I'm going along with the
with the article, what the task force has
what their argument is. The task force, that's their argument. You have this one encounter testing process, and they're saying if you've gone through these accredited programs, you should have some level of proficiency. In seeing your patients, and then you would do the things that you just said. The new implementation, which was getting your DMD or DDS degree. The second thing was to pass the national boards, which will be one exam instead of two, part 1 and 2. And that'll be one part, and then number 3, a residency or the OSCE. Is that what you call it?
Right, OSCE. Yeah. So we want to hear from you guys. What do you think about this this task force report. Do you like it? Does it seem reasonable? Do you think it's going to happen? Would it make you more excited about more excited about exploring opportunities, maybe in other states, maybe states of your dream, maybe places you haven't been before? I mean, what do you think? What do you think? I saw student Dr. JoJo was on. She said she loves. Looks like she gave us a heart. Like she loves the discussion. Yeah, Doc, this is going to pertain to you very soon. In the next 3 years, you'll be facing and having to make some of these decisions, whether or not you do a residency, whether or not it's a national board by that time in about 3 years, which is 2000. Was that 21? No, 22. In 22, where there'll be a national board, will you have to do a residency, or can you do a residency in the state that you're going to, right? So these are questions that the task force has kind of brought to the forefront, and making sure that not only dentists now, the 196,000 of us know about some of the concerns and some of the proposed modern approaches to this whole licensure issue. Is good. Got a comment here on Instagram Live from Dr. I forgot her name, but her from Black Women Dentists 2017. Her comment is, I think doing a residency and obtaining license via residency is a great idea. Yes, that's right. There you go. I actually, I think you're right. Black Women Dentists 2017. And it's not just from a person who's a residency director, but it's also just from my own experience of doing a residency. And you can talk about the same, Dr. Evelyn, but there's just so much stuff that you learn in residency that you don't even get in the 2 years that you're in clinic as a dental student. And you come out of school, you don't even know what you don't know until you get into a situation where you realize, oh, snap, or something else if you have some other English. I don't know this stuff. What the? And and you're supposed to be delivering the care to the patient. The patient's looking at you like, what do you mean you don't know? I mean, they may not say that, but they might turn their head like, oh, you don't know. So, but that's why doing a residency is so great, so important. It allows you to pick up your speed, number one. Number two, it allows you to become more confident in yourself and your skill sets, but also confident, and you now know you've given yourself a better assessment as to where you still need to go, or what you're more comfortable with, right? Seeing 2 patients a day is not realistic. I mean, even the major cosmetic dentists are seeing a little bit more than that. But even if they are just seeing 2 patients a day, guess what? They ain't start out that way. Right, Dr. Evelyn? They did not start out that way. Dr. Wilson, Dr. Lori Wilson says on Instagram, her handle is Black Women Dentist 2017. Dr. Wilson said, yes, taking that 1 year of residency is great to build your skill and your speed. That's right. So important. And we get residents all the time that finish even just 1 year, and how they just are like a totally different person. After 2 years, even exponentially just have grown so much more. Their confidence level is out of this, is off the charts. So thanks for sharing that comment, Dr. Wilson. Lori Wilson, Black Women Dentist 2017 on Instagram. Thanks so much. So that's what we're talking about tonight. We were talking about, will dentistry go to a residency-based type of licensure format in the near future? Or in addition to that, will dentistry have what we call an OSCE, or some kind of structured clinical exam that everybody takes, and it's just one exam, and everybody takes it, you pass it, and it is able to demonstrate that you're ready to go without having to take one patient encounter, or having to pull patients from state to state, or you go state to state to take the exam where you can't follow up. It's not comprehensive care. It's a lot of ethical issues that are going on that have been brought up about how we currently do this examination for licensure. So again, this was a task force. We were just kind of going over this task force that's been together, I think, several years. Is actually made up of a couple of the former chair of the board of ADEA, the American Dental Education Association, but it's under a task force under the American Dental Association, and they put this thing together. It's 11-page document. If you guys want a copy of the document, send me an email at newdentistcoach@gmail.com, newdentistcoach@gmail.com. I'll send you the link that I just got from my colleagues at ADEA, and I can send it to you. It's a pretty good report for information, kind of outlining what's going to be happening, hopefully in the next couple of years. In Canada, I don't know if you knew this, Dr. Evelyn, and then we're going to wrap it up. But in Canada, that's what they have. They have an OSCE exam. They have one standard exam that students take to demonstrate their clinical readiness for practice. So if it's good for Canada, why can't it be good for the U.S.? You know? Actually, there are some dental schools that use OSCEs, and again,
medical schools too.
Medical schools too. Yes, that's one of the. You know what? And I can't remember. Medical schools may even have that. May be the way that they completely license their students to these OSCEs. And I think that might have been in the report.
It was in the report as well. Yeah, medical schools in like you said, Canada.
Yeah. Again, OSCEs are objective, structured clinical examinations that everybody takes. So that's what we've been talking about tonight. We applaud the task force for all their work and doing this assessment for readiness for practice. And I personally, and Dr. Evelyn, I want you to tell us what you think too. But I personally like this format. Let's keep the dental school requirement. You got to get a degree. Let's keep part 1, part 2 of the national board, the written examination, even if it changes. Let's keep that. And then third thing is let's step and move towards everyone doing a residency as part of the licensure, or everyone partaking in a national exam, an OSCE-like type of exam, a structured exam that everyone takes at the same time, or not the same time, but takes the same exam, and that the outcome is the same. That's my opinion. What do you think, Dr.
That's your story. You sticking to it, Doc?
That's my story. I'm sticking to it. Even the tooth fairy got my story now. She knows it, so I'm sticking to it. I can't lie to the tooth fairy because she'll come looking for me.
Well, I think it's a good idea. I think it is, and I think it would just kind of make everything, give some structure and more uniformity, and would definitely help with us when we're moving from state to state to decrease that if we do have that consistency across the board.
Yeah, I think so too. So so that's it for tonight. Hey, thanks so much everybody for joining us. This is another episode of This Week in Dentistry. And again, the goal of these episodes, this thing that myself and Dr. Samuels put together is to keep you guys informed about the latest news that's going on in our profession, but also just within oral healthcare for consumers, for patients. And that's our job. That's our duty, to keep you informed as to what's going on. Dr. Evelyn, if people want to get in contact with you about other aspects of what you do, what's the best way for people to contact you?
The best way would be via email, and it's info@DrEvelynTeagueSamuel.com.
Info@DrEvelynTeagueSamuel. No S at the end.
No S at the end.
No S on the end. That's right. And same thing here. If you get in contact with me, you can always send me an email. Where is it at? Right over there. NewDentistCoach@gmail.com. NewDentistCoach@gmail.com. Thank you all for joining us tonight. For those that are on Instagram Live, thank you. For those that are here on Facebook Live, thank you. And then those of you that are watching the replay on YouTube, thank you. Thank you. We'll see you next week on This Week in Dentistry. Take care.
Take care. Bye-bye.